Founded in 1984 by Dr. Louis M. Nashner, NeuroCom International is the world leader in the development of computerized systems for the assessment and rehabilitation of patients with balance and mobility problems. Dr. Nashner, through cooperative research programs conducted with colleagues at a number of academic institutions, developed the concepts and technology that are the basis for the company's products. The Equitest system, or computerized dynamic posturography, as it is frequently referred to in the clinical literature, was developed initially for NASA to evaluate the effects of spaceflight on vestibular function and balance control in astronauts. Today, NeuroCom systems are used around the globe in a broad spectrum of medical disciplines, including otolaryngology, neurology, physiatry, orthopedic sports medicine, physical therapy, and geriatrics.
With managed care, clinicians are focusing their attention on the patient's outcomes. This imperative is driving interest in NeuroCom technology as clinicians realize that balance and mobility are key factors in outcome in patients with vestibular deficits, neurological disorders, and orthopedic injuries. The key to outcome success is the chronic disease management model. In this model, the traditional localizing diagnosis, which identifies the disease process, is augmented with a functional diagnosis, which identifies the component or components of impaired function. Armed with the localizing and the functional diagnoses, the clinician is able to customize his treatment plan, including surgical, drug, and rehabilitation therapies to maximize outcome in the individual patient.
NeuroCom is dedicated to developing the technology to assist clinicians working in all fields of human balance and mobility, including such diverse areas as fall prevention in the elderly, repetitive and dangerous work tasks, and athletic excellence.
My name's Courtney Moore. I'm a physical therapist from Central California. My physical therapy center is in a small rural community of about 15 or 16,000 people. We refer to ourselves as general physical therapists because when you're rural and in a community like that, you have to pretty much treat whatever comes through the door. 80% of our patient population are orthopedic-oriented type patients with about 15% neuro, and then the balance being wounds and other different kinds of diagnosis. In our lower extremity orthopedic population, probably 80 or 90% of the clients that we treat, we utilize the Balance Master system for assessment and for treatment. And probably in the course of an 11-hour clinical day, the equipment is being used approximately 6 hours in patient care. We started a small balance assessment program and receive probably 2 or 3 referrals a month for just pure balance assessment, just because we have the NeuroCom equipment available in the office.
NeuroCom Balance Master systems provide quantitative assessments that identify functional deficits, which are critical to activities of daily living, to better enable clinicians in establishing a baseline for treatment planning. Through objective evaluation of weight-bearing symmetry, voluntary motor control, and neuromuscular coordination, as well as sensory integration and the patient's overall adaptive responses, the clinician can identify the sensory and/or motor dysfunctions underlying these deficits and thus focus their therapy program more effectively.
Hi, I'm Dr. Peggy Trueblood from Fresno State University, and I currently have a balance clinic there as part of an academic program. We currently use both the Balance Master as well as the Smart Balance system. The clientele that we have are a little bit of a wide variety. We treat anything from stroke patients to vestibular patients. We use both systems quite frequently, both for evaluation as well as treatment.
The Balance Master allows you to do sensitive tests. So in other words, there are clinical tests for balance that you can do. They're very reliable, they're very inexpensive, they're very easy to do, but they don't give you a lot of information. They tell you whether or not a person has a problem, but not what the problem is.
Sensitive real-time monitoring of the patient's movements during functional training provides instant visual biofeedback to the patient. By seeing how they are performing, patients achieve better balance control faster. The exercises can also be tailored and adapted to match the patient's capabilities. In addition, the system automatically documents training compliance, which enhances the clinician's ability to monitor patient progress.
We find that our patients find the equipment very motivating. They like the visual feedback, and it's much easier on us as clinicians to train them using the equipment because they rely less on our kinesthetic touching and cueing and more on their own visual system to learn where they're at, and they seem to learn things quicker, and I feel they accomplish faster goals.
The Balance Master has been an asset to my practice in that it's incredibly difficult for patients to understand what standing is and movement is, and for insurance companies to recognize the objectivity that goes into an assessment and outcome studies.
I'm working with the NeuroCom Balance Master, the Smart, and the 5-foot force plate. I use it for mostly balance problems, posture problems, and mobility problems. I have a fall prevention risk reduction problem that I use it on with the elderly.
NeuroCom's clinically proven protocols, which systematically assess and train the sensory and voluntary motor control of balance, are integral to the Smart and Pro Balance Master systems. Training on an unpredictable moving surface adds biomechanical and proprioceptive challenge, while the movable visual surround demands heightened sensory processing and resolution of conflicts between sensory systems.
We use the Smart Balance system for really just about most of our patients, primarily because it particularly has the added beauty in terms of the force plate system, the moving force plate. We put our elderly patients in there. We use it a lot for treatment, put them under various conditions, try to challenge their balance, try to retrain their balance predominantly. We do it for testing in terms of the sensory organization test. We do that routinely with all the clients that come in.
In addition to providing objective information for the diagnosis of balance and mobility disorders, the computerized systems provide clear documentation of the patient's initial deficits, progress, and functional outcomes. Documentation enables the therapist to better communicate, not only with referring physicians and payers, but perhaps more importantly with patients and their families.
My name is Linda Horn. I work at St. Agnes Healthcare in Baltimore, Maryland. We're an acute care facility. In the outpatient department, I use the Smart Balance Master to evaluate and treat patients either who have had falls or patients that are at risk for falls. Some of those are identified through community screenings, others are identified by their primary care physicians, or some of them just come in because their family members want them to come in and be evaluated. We're able to identify problems that I can't really identify with clinical balance tests, and I feel that it gives me an opportunity to document objectively some of the problems and to use it to justify why they need therapy. Sometimes it's not real evident, and by having this type of testing that's objective, I can use it to make some justifications for the insurance companies. We found it to be fairly successful, and a lot of the patients that may have had some functional difficulties after balance training do well, and they're able to either stay in their home or able to move to a setting that's maybe not as restrictive.
We find that by providing them with limits of stability, the modified SIP-SIB test, unilateral stance tests, and some of the mobility tests such as the walking or the quick step turn test, we're able to provide the doctors with more justification to allow them to let us work with their clients.
Because NeuroCom systems are applicable to a wide range of patient populations and clinical settings, we provide complete clinical integration training and support to all our customers. At the Clinical Integration Seminar, our staff clinicians teach more than just how to push the buttons. The classes are designed to provide a complete overview of the system's capabilities, data interpretation, the role of that objective data in designing a course of therapy, and the opportunities the technology brings to their clinics for further program development. Equal to NeuroCom's commitment to creating efficacious technology is our commitment to work with our customers to maximize the benefit of the technology to their practice.
Virtually anyone who comes into my clinic is a candidate to either be assessed or treated with the equipment. I see in the future probably expanding into a stronger balance program and attempting to get more regional referrals rather than just local referrals from physicians within 5 or 10 miles of my practice.
At NeuroCom, our goal is to work with you, the clinician, to maximize the functional capabilities of your patients and minimize their disability.